I do have David Katembo. He's the Executive Director of OLDDRIFT Initiative on Mental Health Care, coming from Livingstone, Southern Province. I'm blessed today that I have the whole team. Almost for each province at least is being represented here. Thank you so much. Now, Mr. Katembo, what is this organization all about? OLDDRIFT Initiative.
Thank you so much, Mr. Piri, and good morning, viewers. OLDDRIFT Initiative on Mental Health Care, this is an organization which was established in 2019 with the sole purpose to actualize a community that is sensitive to mental health as well as respect for human rights. Professionally, I'm a mental health specialist. But during my profession, my practice as a mental health specialist, one of the things that have come out is that persons with mental health conditions or disability have not been taken care of the way they are supposed to. If you have seen, I think this is now, it has become like a universal problem in Zambia, where we have a lot of persons with mental disability in the streets, and yet we call ourselves a Christian nation. Why? Because we have neglected them when they deserve to be given that empowerment, the social care, psychological care, and all the needs that they have. Because outside there, the community think these are not people who should be taken care of. So our organization now is there to sensitize the community, to help them understand, to say, persons with mental disability, they are also human beings. And they deserve to be taken care of. And they can also do work. Because while they are neglected in the streets, people think they are, they are a burden. There's nothing that they can do because of the illness. So now we are saying, no, let's change the way we look at them. They are human beings who should be attended to just like any other. Briefly, this is what it's all about. And I'm sure you have seen what is happening in Livingstone. Yes.
Okay, so this organization is just based in Livingstone, or is it located around the country?
Yes, currently it is based in Livingstone. Our aim is to make sure that it becomes countrywide, and not only countrywide, Africa-wide. Why? Because if you have done your research very well, you find that the issue of negligence of persons with mental disability is very prominent in Africa. Zambia being one of those, and in Lusaka West. Right now, as we speak, for example, Livingstone, we have got more than 500 persons living with mental disability. And of these, more than 100, when we did our physical survey, are in the streets. I don't know Chipata. At the moment we came here, we were greeted by the same people there. They are in the streets. So we want to be everywhere once we secure resources, and we are calling upon stakeholders to come on board so that even here we start Chipata. I'm happy we are here. We want to start from Chipata before you can go to another district or province.
Okay.
Yes.
And we have seen there at times there are some homes where there are people with mental disability, and you discover that they just look them. They are not giving them chance to come outside. They will just confine them in a home. What would be your word of advice to those homes and those people who are behaving in that manner?
Thank you so much. That's a great question, and it is everywhere. That's why we are here to create awareness. The reason why persons with mental disabilities are secluded or held, others are tied, like a certain case in Livingstone, where for 4 months this person was tied in chains. When we found out the reason why the person was being chained, the mother said, I have nowhere to take this person. Because when I untie him, he will go into the street and people beat him up to say, Nchofunta. So I don't want my son to die even if he has got a mental disability. So I would rather tie him. Okay, so now the thing that we want to, which we are creating now, is awareness. One, we want the community members to understand, to say, people who suffer from mental illness are still human beings. We should not look at them as patients, but as human beings. The difference is when you look at them as patients, you just look at the illness and it ends there. But when you look at them as human beings, you'll find that you go beyond the illness. You start even saying, okay, this which I'm doing to them, would I appreciate if it was done on me? So also to the mothers or the relatives or the care supporters, we are saying, please allow them also to have freedom. You know, help will only come when people see that there is need. So if you hide, people not realize that there is need here, which here we have Chipata Central. Is it Chipata Central Hospital?
Yeah.
We have a psychiatric department. Take them there, let them be treated. Then we are calling upon stakeholders to say, mental illness is not all about getting treated with medication. They need social treatment also. They need economic treatment. They need educational treatment. Okay? So let's partner. Like, I'm happy, Chipata, what you are doing, CBID and the media. I am really interested to see that also mental health is incorporated. At least the CBID, the other disabilities have been taken into consideration. But the issue of mental disability is not much. So we are saying, let's work together as media to sensitize the community to say, let us not stigmatize. That attitude which we have of thinking these are not human beings, allow them to eat dead food in the streets, should come to an end. Imagine, Mr. P, the way you are today, you are here. Tomorrow, like the other presenter said, you may find yourself having the illness. Surely, should I be happy to see you eating dead food in the streets? No. I should take care. I should feel that hard to say you are a human being just like me. Yes. So awareness is key, and this is what we are fighting. That's why we have come together with other stakeholders, CBID, so that while other issues to do with disabilities are being taken care of, even mental health should be part of that, because we can't work in isolation. We need to work as a team. The media, the religious leaders, and other stakeholders, we need to come on board to make sure that we fight it together and we fight a good battle. Okay.
Do you just target those people with the mental health? Or because there are some people, sometimes you discover that they are just depressed. Should I say, is he, what word can I use? He's just okay, but he's having some, he's depressed.
Okay.
Do you also target those people?
Thank you so much, Mr. P. Now, when you look at mental health is very broad. Okay, there is mental health at workplace, mental health in school, mental health at church, everywhere. So our focus is any person. Actually, we are not waiting for somebody to break down, then us we come in and help. No. We are saying we need to preserve. So we are basically looking at 4 parameters. We are talking about awareness, promotion, prevention, and rehabilitation. These are 3 things. So now, right now, what is happening is we are just we're working on in fact, the treatment is the one that we are focusing on. Meaning, waiting for somebody to fall sick, that's when you start treating. We are saying, no, let's make sure that before it reaches that end, we come in to help out. We should be sensitive to somebody's needs. For example, somebody is stressed, and you say, you and I, we don't understand the issue that somebody is going through. We underrate it. Next thing, this person gets depressed. The following day, you hear the person has committed suicide. That's when now you come here and say, I wish we were... No, we are saying we are attending all manner of mental health. So long as it has to do with mental health, as we are saying, we need to come. But at the moment, we are a bit biased on those who are in the streets, because these are the people, one, who have been excluded from all forms of care. Talk about health care they can't receive. Like Livingstone, if I were to give you an example. Livingstone, there are 2 cases where these patients were found just dead. And you know, they will just say, oh no, he was here and he died. And it ends there. No one takes the responsibility to find out why did he die, what killed him, and whatever. So we are saying, no. The reason is that these people, no one knows when they are sick, when they need medical attention, or urgent medical attention, and when they actually need something urgently. As a result, they just die like dogs, and we are saying, let's attend to them. So we want them to move out from the streets. Once they move out from the streets, we link them to care. Once we link them to care, they are stable. We want to link them to empowerment initiatives which government has brought. Then from there, we'll start working with these other issues. That's why we are working with the other partners, like the District Health Office. Even here, so you have District Health Office Chipata. The media is a key drive in terms of mental health awareness in the community. So we are here, Chipata, please help the district health office of Chipata to sensitize the people concerning mental health.
Okay.
Yes.
Madam Kateka, you're coming from Central Province, Kago to be specific. You are the coordinator there in Kago. How is the situation like in Kago?
Concerning mental health?
Yes.
The situation is the same, I would say, everywhere. And I'm so happy that I'm part of the team that has come to Chipata. And I'm able to learn from the coordinator from Livingstone on how they're handling issues of mental health. You know, this is an issue just like we are talking about other issues to do with disability. This is an issue of concern for everyone, every Zambian. Countrywide, it's a concern for everyone because it's in every part of the district. It's in every, I would say, if one is not infected, you are affected because there are people that have it within the home circles, but the way they are treated within the home circles is what is very, very, you know, the way people are treated, these people, the so-called mental patients, the way we are handling them in homes, that is what the society is taking it to be. But if it starts from the home perspective, where you handle them, as Mr. Katembo has put it, they need love. If that love begins from the home scenario, then even the community will understand to say that these are just people like any other person, because they didn't choose to have that mental illness. It's just a condition which can be avoided at a certain point. If they are given the love, they are given the care, they are given all the support, then again you find that in these same homes, you find that these people, there's that segregation of maybe using of utensils. You say, Charlie Pena, maybe you even segregate the way you save them food. You know, you give them like, you know, like they are not people because they are born within the homes also. So we need to show love just like any other normal person. And if that is spread out, just like we have spread out issues to do with HIV, whatever, you know, they need that love. And once they see that they are included or they are accepted, then that issue of their illness eventually starts reducing.